program you are about to hear is largely fiction, science fiction. We make no guarantees, however, how long it will remain fiction.
Our computer is picking up a strange signal. Here, sir, you better take a look at it.
Trade organizations like IRSA and the MFA and professional organizations like the Coalition for Registration of Exercise Professionals have been advocating for the well-qualified exercise professional as that community-based resource that consumers can rely on for programs and leadership to help them live their healthiest life. Predicated on that, though, is that the individuals hold and maintain credible certifications that are on par with the other adjacent health occupations like athletic training, dietetics, physical therapy. People frequently ask what the future looks like for the exercise professional, specifically around education and credentialing. Our belief that while there may be some turbulence in the months ahead for the current and future exercise professional, the future is overwhelmingly bright. Schools are open again, students are graduating and earning certification, and employers are eager to hire them. There is also a push to provide a more diverse and welcoming environment for all persons, both participants and a workforce that more closely resembles our communities. We're seeing a much more diverse set of certification candidates than we have in the past. For those that are interested in a more entrepreneurial route, there are new tools and platforms to support their business and clientele, and continuing education credit is available from those courses and workshops that go towards renewing their certification. We believe that professionals would be wise to pursue education and training on technology, business, sales, marketing to supplement their skills in developing and delivering exercise programs. When we take a longer view, there are a number of initiatives that we believe have potential. Organizations like the Physical Activity Alliance are working on exercise prescription and coverage determinations with the Centers for Medicare Services, CMS, and we are closely following the AMA CPT panel meetings for opportunities to include qualified exercise professionals as part of that service delivery team. Part of that effort is the creation of an exercise referral framework that places patients, clients, or athletes on a continuum as opposed to a hierarchy based on the level of physician oversight necessary. That oversight includes physician supervised, like you'd have in a cardiac rehab environment, physician referred, those individuals that have chronic disease or other conditions, physician cleared, which would be for athletes, contingent to their participation, and or physician recommended. This allows every professional on the continuum to practice at the top of their credential or license.
I think that there is a range of types of credentials, and I think educating and raising awareness about the rigorous credentialing path versus the not as rigorous credentialing path. So really distinguishing ourselves as credentialed fitness professionals for those who might not have pursued as rigorous a process. I would also say that it's not one time, I got my credential 20 years ago, and that is my knowledge base, really showing how we evolve as fitness professionals. I'm a huge supporter of specialty certifications. I'm a huge supporter of continuing education, showing that we as fitness professionals are constantly striving and learning and adding to our knowledge base to show that we can work with different types of populations and help them achieve their best health outcomes.
You just listened to Graham Melstrand and Dr. Amy Bantham, two wonderful colleagues of mine and people who are really trying to do incredible work to help raise up the credentialing and training of our profession. What you've heard is that there's a long way to go, but there's certainly a bright outlook, and having these discussions and having action about them is really important. Michael and I step into this arena provide an engaging discussion about credentialing and training. Sit back, relax, enjoy the discussion.
This is Mike Stack, host of the Wellness Paradox podcast.
This is Dr. Darian Parker, host of Dr. D's Social Network.
And this is the Frontline of Fitness.
Where are we at in this whole training credentialing journey as opposed to where we were? Or is it any different right now?
Yeah, it's interesting. So where are we at? Well, again, we talked about in the first episode, we're in our infancy here as well. I think over time, with the proliferation of just fitness in general, and more people have gotten involved in fitness over the years, and there's certainly been more opportunity. You see more and more certifications spring up, more and more academic programs spring up, and if anything, that has added to the confusion and the noise, not taken away from it. And right now, I would say the state of both our certifications and our academic education in universities and colleges it's very fragmented, unlike any other aspect of allied health. This is physical therapy school, nurse practitioner school, med school. There are these standardized curriculums and credentialing across the entire ecosystem that are standardized, and everybody understands that is what it is, and it's the path you follow. And what's important there is not only do the practitioners and clinicians understand that that's the path, but the public and the payers, the health insurers, they understand that's that path. So there's this universal understanding, whereas, as I mentioned in the first episode, no one knows the difference between an ACSM certification, which those of us that are in the industry know that is the gold standard, and rightfully so, versus a certification like the ISSA certification, which isn't a bad certification by any stretch of the imagination, but it's just different. The ACSM, you have to have a degree for it.
Yeah.
And so I think that is the challenge.
I think what we can see though is that there's a level of rigorousness between the different certifications that the consumer has no clue, whether you're NSCA, ACSM, whether you're ISSA, you name letters for it. And some may have, or CSCS, some may be, you have to have a bachelor's degree to sit for a test, and others like, hey, I was on the internet and I saw this and I said, why not me? There's no uniformity with it. And to your point about colleges, I've had some very interesting discussions with professors and different universities, and you're affiliated with the university, University of Michigan, and I've talked to some different places, and a lot of the students coming in are not coming in to be personal trainers. They're coming in to do the DPT program, other like programs, and most of the curriculum is geared towards those programs, with a very, very tiny percentage of them wanting to actually have a fitness-based career. It's what I'm seeing.
Yeah, I agree. But I do think on some level that is changing. Like at University of Michigan, we have an applied exercise science curriculum that I teach in that is very much designed for people that want to be, frontline fitness professionals. And then we have a movement science major that is the pre-professional major, where people go on to get a terminal degree in physical therapy, or they go to med school or PA school or something like that. So I think the good news is that's changing on sub level. The challenge is that it just because it is changing in the sense that these programs are starting to occur doesn't mean there's more standardization. If anything, there's probably less standardization as these programs all decide to do different things. So I think what the hard circle to square here is that there's two elements to this, really. There's academic learning in a college or university setting, and then there is post-academic credentialing, which is supposed to be verification of your practical skill set. And somehow, some way, those two worlds need to talk to each other and work with each other. And then there also needs to be uniformity from university to university to ensure, what we're teaching our students at University of Michigan is the same thing that is being taught at University of Washington, at University of Texas. So when everyone graduates from their academic program, they have that baseline level of knowledge that allows them to get the appropriate credential, which then that leads to the other challenging question, which is, what is the appropriate credential? We have a for-profit certification based in the fitness industry for the most part. Not everyone's for-profit, ACSM, NSCA, ACE or not, but they're all vying over the market and they're all trying to be the one. And this is where there needs to be some reform. Now, I don't know exactly what that reform looks like, but what I do know is that it's not going to happen without collaboration. It's not going to happen without the people from the major certification organizations, ACE, ACSM, NSCA, NASM, those kind of groups, all getting into the same room with people who are from academia and saying, this is what we need to do to advance this industry from a public health standpoint and also from an academic credentialing standpoint. And it's hard because there's a lot of different opinions there. There's a lot of egos there. I don't think universities necessarily want the ACSM, NSCA, and ACE to tell them what to do. I don't think ACSM, NSCA, and ACE wants to be told by the universities what to do. So somehow, some way, we're going to have to come to consensus on this because, Darren, this is the root of, I think, a lot of our challenges is that, we have a trust issue because we have a credentialing process issue. And until we are willing to have those hard conversations, make compromises, and have a education and credentialing system that mirrors all the other allied health professions, medicine, psychology, dietetics, nursing, go on the list. It needs to look the same. The template's there. It's right there.
It's there.
We just need to step up to the plate and be willing to deal with the messiness and discomfort of making that a reality. And quite frankly, everyone everywhere probably needs to set their egos aside for the larger goal of actually getting us onto the healthcare continuum.
That, I feel like I've had this conversation since like the early 2000s.
Yeah.
But this is one, and like the body type one is kind of new. This one I feel is old, like since the beginning of, this is something that I honestly, like, we're going to have people on, and this is a great thing I think about this thing we're doing is we're going to get you some amazing people from these organizations to give some clips, snippets about their viewpoint for this. But you have so many certifications that it's almost dizzying, the number. Mm-hmm. And then what's the right pathway? But then you also have commentary that I've heard that some really high up people are like, we just need to blow it all up. We need to bring it to its knees and start over and have like a pathway for this. It almost mirrors to me, this is kind of almost mirrors streaming platforms. How many streaming platforms are there now? Right? Yeah. It's basically like a personal training certification. Can you have Paramount Plus, Hulu, Netflix, you name it, everything. And it gets saturated when you have all these things and people get paralyzed by the amount of options that they have. Right? So we have to come together, get rid of our egos and say, hey, the template is there. There are board certification exams. There are one-way processes that everyone can go through, that people have trust. Say, oh yeah, I know that these people all went through this process. Mm-hmm. Versus when you get somebody in, you're like, well, did you like sit for this over the weekend? Or was this kind of like you went to college, you didn't go to college? Like, what's the deal? Getting all those people in a room would be amazing. I would love to hear from them. What's the plan? Because I don't know, honestly.
Yeah, it's going to require a lot of really, really smart people to, as we said, to set their egos aside and to really consider the greater good here. But yeah, I don't know what the plan is either. I mean, shoot, if you or I knew what the plan is, we probably wouldn't be having this conversation. We'd probably be going to implement the plan. But yeah. I know that it can't start without more honest, vulnerable conversation and candor. And here's the thing, as we sit here and talk about this, it's not as if all is lost and this isn't happening at all, because these conversations are starting to happen. I just think they need to happen more broadly and more frequently, and just with a lot more authenticity in service of the larger objective here, which is, if we do this the right way, then there'll be so much abundance for us to be able to all enjoy that, I think the scarcity mentality that's really resulted in a lack of collaboration in the past will start to fall away, because we start to realize that other 80% of the public that never engaged with us, now they're going to start to engage more because they trust us, because they understand the education process that we went to. It's kind of like, you hear that a doctor did their medical school training, in the Caribbean. And that's not to say that you can't be an amazing doctor and do your medical school training in the Caribbean. But when people hear that, they pause and they question it for a second. And it's almost like in our industry, that pausing and that questioning is happening all the time. And what you said earlier, I think, is really important to highlight. It's this paralysis of analysis. It's just like, well, ACE, ACSM, NASM, degree, no degree, looks great, is a little bit overweight. There's all these decisions, and people that are ambivalent about exercise and physical activity, all of a sudden they're like, well, the heck with it. Like, I don't know what to do, so I'm just not going to do anything. And we are causing the very thing we are trying to prevent by all of these various education vehicles that exist.
We totally are. And it actually brings me to another facet of this, which is like the state licensure conversation, which I remember this being a much larger conversation, maybe like 8 to 10 years ago. There was a lot of momentum in states like New Jersey and different places that were trying to push for state licensure. But then I also was reading in that a lot of the certifications, I could be wrong, my memory may be hurting on this, were against it, actually. So I don't know what you've seen with this, but I know there's been a lot of work in this area, but I haven't seen it so much in that lately, but I may be off on that.
Yeah, it's something that you hear often talked about, and it's a word that definitely generates a visceral response from a lot of people. Licensure is a way, I think, to handle something like this at a state level. I think the concern, broadly speaking, and I would echo this concern, is that it does suggest a level of regulatory compliance that might be onerous for a fitness professional or a health and fitness club. I think, broadly speaking, we're not interested in the government, poking around in our businesses, any more than what they absolutely have to. And if that was true before COVID, I think that is, infinitely more true now. So I think you are correct. Licensure has been talked about. It's been batted around. There doesn't seem to be a very strong appetite for it among the certification organizations, certainly amongst the commercial clubs. And as I said, I don't know if it addresses the fundamental issue as much as it just seems to address a symptom of the problem. And saying, okay, hey, we're licensed by the state. Well, great. Does that resolve, the continuity in our academic curriculums? Does that resolve kind of a credentialing board or some type of examination that is standardized? Not particularly. So I think, yes, it is a lever that can be pulled, but I don't think it's the lever. And I think it's why you've seen, people go away from it. I do think, the certification for it's CREPs. So it's the certification for registered exercise professionals, I believe, is credentialing for registered exercise professionals. I'm getting the acronym wrong, and I feel very, very bad because I just had Graham Milstrand speak in my class at U of M, and so we were talking about CREP, and I can't remember the specific acronym, but nevertheless, if you become certified through an NCCA accredited certification organization, ACE, ACSM, NSCA, and so on, you become part of this registry of exercise professionals, and that moves us in a positive direction. But there again, not a lot of people even know that CREP exists. I mean, I know, know, some industry people know, but not all industry people know. Again, and it's because it exists out there in just this this fragmented chasm that is our industry. And look, the infrastructure is there for that. It's there. We need to operationalize that and leverage that a little bit more. And we're just not right now.
What do you think about, I mean, I've thought about this, and I think there was some argument about this, I mean, related to licensure, but even beyond that, just like the more rigorous level of a program or entry into a system, I think there's been some complaints that may greatly decrease the amount of professionals in that industry. What are your thoughts about that?
Yeah, all these things are double-edged swords, right? And there's consequences, in some cases, unintended consequences to your actions, your decisions. I think that could be true if we weren't intentional about the way we structured it. But what I foresee is a continuum of providers that would allow us to actually broaden the opportunities. And I'll use the physical therapy realm as a good avatar for what we're talking about here. In PT, you have a physical therapy tech, you have a physical therapy aide, and then you have a physical therapist. And there's these different levels of care that could be provided by each of these different professionals. And I think we can structure a system like that. I'm not saying that absolutely everyone needs to train with someone who has a 4-year degree and is certified by the American College of Sport Medicine as an exercise physiologist, because everyone doesn't need to be trained by that kind of individual. Some people can be trained by other individuals that were properly credentialed and trained, that are working at the top of their license. And that is the buzzword in healthcare. We want everyone working at the top of their license. Someone who's got a 4-year degree, who's credentialed by some national standard, that's the person that should be working with the individual that has multiple comorbidities, that understands that special population. The vast majority of people that are coming to a fitness club now that are just looking to maybe lose 10 pounds, get a little more jacked, be in better shape, they can work with those professionals that are maybe less rigorously credentialed. So whereas some people might view it as, man, you're cutting our legs off by requiring a higher ceiling for entry into this field, I very much see it the other way. We could set a high ceiling that allows us to accommodate the more complex populations, but then we can taper down from an educational and a credentialing standpoint to other professionals. And in my mind, structuring it in that manner would actually lead to a more viable path for those people, meaning the people right now that have been in the industry for a while that kind of pop in and pop out of the people who maybe don't have the opportunity to have those formal educational experiences. And so I actually think that if structured the right way, and again, I certainly don't have the answer in its totality, but if structured the right way, it leads to far more opportunity, not less, because you have a more educated and valuable workforce. And then you have greater demand in the marketplace because we've driven more trust with the consumer, with the healthcare professionals, and with public health officials. And then it becomes this virtuous cycle that just success builds on success.
And it's funny, is like you said, there's a playbook for this on many ways. I mean, it's like my wife is a nurse.
Yeah.
And nursing is a great example because you can start, like she teaches nursing at the college here. And, you can teach in the actual nursing registered nurse program, the LPN, certified nursing assistant. And often you have people in those programs that maybe start as a nursing assistant and then want more education and move up and then maybe become an LPM. And then, hey, I want to become a registered nurse. And then on the highest level, you may become a nurse who has their doctorate and then work in the collegiate system as maybe the dean or the chair of a department. And it's a more research-based nursing position for that. Feels like that could be a similar stepwise progression for us as well.
Yeah, you absolutely got it. Again, we do not need to reinvent the wheel here. We have a medical and allied health education system in this country that, in terms of what it needs to do, it works well. I think, and we'll get into this in our next episode. I think there's some issues with the overall structure of healthcare and healthcare policy in this country. But as far as educating qualified professionals to produce consistent health outcomes, we do it. Here's the challenge, and we said it earlier around, do you just blow this thing up and you start over? as attractive on some level as that may be, I don't think it's feasible, although we've kind of already been, we haven't been blown up completely, but we've been pretty wounded by the pandemic. And this is why this inflection point exists. Like if there was ever a time to do it, it's now when, the market has shrunk, the number of professionals has reduced. This is a much easier thing for us to do at this point. What are the steps to, kind of put the genie back in the bottle a little bit and then, get it back out? I don't entirely know, but I do think it starts with this, analysis of, the education system first and how that interplays with the certification and credentialing system. And it's having conversations, and it's trying some experiments. I mean, ultimately, I think, there could be small scale experiments ran to actually see the viability of some of these ideas before we scale it up on a national level. But again, we've talked about this many times. It has to happen, because if it doesn't happen, we're just doing the same thing over and over and over again. And we're going to keep getting the same results over and over and over again, which is, again, we're working with the same 20% of people. We're continuing to get the fitter, while at the same time, the other 80% of the population becomes more diseased, more unwell, leads worse lives, and ultimately become a massive economic drain. And not to put it in a crass or non-humanistic way, but they become an economic drain on our society, because eventually, as all these chronic medical conditions become more and more severe and we get more and more of a critical mass of people, the healthcare system from an economic standpoint starts to collapse on itself. And then what do we do?
Right. I always envision the educational. I really think that's the root aspect of it. I always envision, well, thinking about the job of, let's say, a fitness professional, which encompasses so much more than just exercise or physical activity, and that this human needs to have such an incredible, well-rounded education to handle the psychosocial, environmental, emotional aspects of working spirituality with a person. And I envision, like, I was very fortunate. My education as a fitness professional, I think, was well ahead of its time. I mean, part of our requirement was to have a therapist, and we had basic counseling skills. I mean, this was in the 90s. This is like way ahead of its time. In addition to, obviously, we learned through the ACSM handbook. I think it was the black book that I learned from then.
I remember that.
Remember that, right? And so it's like you're doing the YMCA bike test protocol. You're doing everything, man. You're doing hematocrit, all this stuff, Wingate tests. I mean, it's great. Like if you want to work in a laboratory, in a sense, and want to be more of a hospital medical based, maybe exercise physiologist, but it doesn't address actually being in the larger public out there, people going to gyms and things of that nature. And I always often see like an education system that has an heavy emphasis on the psychology of working with people, the kinesiology, the study of moving with people, understanding the business aspect, because a lot of people who get in the business have zero business acumen, like zero. And that's what I hear from a lot of the professors, is that the students are daunted by the prospect of being in business and fitness, because they don't have the business background, and it feels like this is not a secure way to have a career. If I go and do the DPT, I know I'm going to work for somebody, I'm going to have a stable paycheck, all those things. We have to make it more enticing for people coming out of high school or going to college to say, this is an actual career for me, and it's going to be more stable,
Yeah, and there's so many things to that to make that a reality. Certainly the payment element, the reimbursement element, like, how do we do that? But it starts with, I really believe this, Darren, it starts with, we need to do a viable career needs assessment for the modern day fitness professional.
Yes.
Like and when I say we, I mean broadly as an industry, we need to sit down and say, what are the knowledge, skills, and abilities that this individual needs to have? Not what we think they need to have from, the way our curriculums were developed in the 80s and 90s, but what does the current day professional need to have? And how do we ensure that that's a thread that we can weave through all of the programs throughout the country, all of the credentialing exams, and how do we ensure that they maintain those skills year after year after year to maintain their credential or their license? So It's difficult. And on some level, it's a chicken or the egg thing. It's like, okay, if we get the reimbursement, then it becomes easier to do this. But if we don't do this, we're never going to get the reimbursement. And again, I don't have the perfect answer to that, but I will say anything worthwhile requires sacrifice and effort. And on some level, we just may have to bite the bullet and say, okay, we need to invest in when I say we, that is, the commercial fitness industry, the medical community, our government, we need to invest in getting this right now, because as chronic diseases proliferate and they start to become more and more commonplace and more economically messy to handle, and our healthcare system does start to become overburdened financially, then we're at a point of no return. Eventually there becomes a point where we do fall off the healthcare economic cliff. And when that happens, I really don't know how you come back from that. There's not a vaccine coming to save us from chronic lifestyle diseases. It's just not happening. We as fitness professionals are that vaccine, but we need to do our work to make sure that we actually get out of the clinical trials phase and actually are the shots in people's arms that they need to actually address some of these chronic health issues.
Man, Michael, you weaved through that very deftly. Like that was amazing. Oh my goodness. And speaking to that, especially as people enter that morbidity window, where generally when people start developing chronic disease and things start to change with people's body and their mind, especially with all those things, we now know that more people than ever are in poor health for a longer period of time once they get into that window. So we're already seeing the train is going downhill. It's happened already. So we got to do something, because this thing is starting to tip the edge and go, hey, we're going to spend a long time and financially crippling people and in their lifestyle, in their lives,
Yeah, it's the interesting dichotomy and paradox of medicine. We give people the ability to live longer lives, but not necessarily better lives.
Yes.
And it's the difference between health span and lifespan. Lifespan is how long you live. Health span is how long you live healthfully. Sadly, lifespan has reduced as of late,
right.
But it's in the mid 70s, somewhere like that. And health span for most people sits in the mid to late 50s. So that means you're living 20% of your life in relatively ill health. And when we say that in healthcare, it's 20% of the people cost us 80% of the money. Well, as you start to live longer and more diseased, that monetary amount is going to become higher and higher and higher. And again, we'll talk about this when we get into the healthcare system and healthcare policy, but eventually we cannot pay for it. Like eventually there's just not any more money in the piggy bank. And when that happens, if I don't have the answer to how we standardize credentialing in our industry, I really can't even begin to wrap my head around the just cacophony of challenges that occur when you break the bank in our healthcare system.